Have you ever noticed how during a really stressful week, your skin just decides to act up? Maybe it's an eczema flare-up, a sudden breakout, or just some random annoying itch? Well, it turns out that's probably not a coincidence. Today, we're going to dive into this powerful and honestly often overlooked connection between our nervous system and the health of our skin.
It's a question a lot of us have asked, right? We usually think of skin problems as being, well, just skin deep. But what if the real root of so many chronic skin issues lies much, much deeper? What if it's all tangled up in the complex wiring of our body's master control system? That's exactly what we're going to unpack. So to really get this, we first need to look at our skin in a completely new way. It's not just a simple covering. Yeah, forget thinking of your skin as just some kind of simple barrier. It's actually a super active, intelligent organ, and it is jam-packed with a dense network of nerves. These nerves aren't just for feeling touch or heat, they are direct communication lines to your central nervous system, constantly sending and receiving signals. It's a two-way street.
And the key player in this whole communication network? It's the autonomic nervous system, or ANS for short. The best way to think about it is as your body's autopilot. It's the behind-the-scenes operator that's managing all the things you don't have to think about. Your heartbeat, your breathing, and, super important for our topic today, blood flow and sweating in your skin. So the ANS has two main branches that are supposed to work in this beautiful, delicate balance. You've got the sympathetic system, that's your gas pedal. It revs you up for action, the classic fight or flight response. Then you have the parasympathetic system. That's the brake pedal. It tells your body it's time to rest and digest, to calm everything down. When these two are in sync, everything runs smoothly. But when they're not, well, that's when the problems can really start. So what happens when that balance gets all thrown off? What happens when the gas pedal is stuck to the floor, especially in our skin? This is where we start to see a direct line to chronic skin conditions. And you can see the consequences right here. Take psoriasis and eczema, for example. Stressed out nerves can literally release inflammatory substances directly into the skin. Hyperhidrosis, that's excessive sweating, is a textbook result of an overactive sympathetic system. And Raynaud's phenomenon, where fingers and toes turn white and blue, that's the same system clamping down way too hard on the blood vessels. You see, these aren't just isolated skin issues. They're clear, physical signs of a neurological imbalance. And here's the really tough part. For so many people, these conditions are a lifelong battle. Conventional treatments are often just managing the symptoms, the rash, the itch, the discomfort, but they don't always get to that underlying neurological root cause. And that leads to this incredibly frustrating cycle of flare-ups and temporary relief because the fundamental imbalance is still there. So this reality, it really forces us to ask a totally different kind of question. If the problem starts with the nerves, maybe the solution should too. And this is the big, pivotal question. Instead of just putting creams on the surface, what if we could develop a therapy that reaches deeper? A therapy that's actually designed to recalibrate the autonomic nervous system itself, to calm down those overactive signals that are driving all the inflammation in the skin. And this brings us to a specific approach that's detailed in our source material, which proposes a way to do just that. The source introduces a concept called the scientific methodology of Hijama. Now, the central idea here is to use targeted physical stimulation on the skin to influence the underlying nervous system, with the ultimate goal of restoring that crucial balance between the gas pedal and the brake pedal. The proposed logic here follows a really clear chain of events, kind of like dominoes. First, you stimulate very specific pathways on the body. The idea is that this directly influences and helps rebalance the ANS. Then, that rebalancing reduces what's called neurogenic inflammation. That's inflammation literally caused by the nerves. And ultimately, that leads to an improvement in the skin's overall health. So, how does this actually work in practice? Well, the methodology isn't random at all. It targets very specific anatomical pathways. Let's break them down. First up, it targets central pathways right in the head. The focus here is on the major venous sinuses, which are these key drainage channels for the central nervous system. The goal, according to the source, is to essentially reset the system right from the top down, influencing the core control centers of the autonomic nervous system. Next, the approach moves down to the neck and the upper back. Now, these areas are absolutely critical because they're home to the sympathetic nerve chains, that gas pedal we keep talking about. By targeting these pathways, the methodology aims to directly regulate those fight-or-flight signals that cause issues like excessive sweating or constricted blood vessels. And finally, It addresses peripheral pathways on the limbs themselves. This is all about getting a more localized effect. So for a condition like Raynaud's, the focus would be on the arms and hands to directly try and improve circulation and calm those overactive local nerves right there in the skin. Okay, so that's the theory. But it's really important to place these ideas in the context of broader scientific research. Do these underlying principles actually have support out there in the wider scientific community? And what we find is that the core concepts are definitely subjects of global research. You have studies from folks like Choi and Azimi that have confirmed that this neurogenic inflammation is a real, significant factor in conditions like eczema and psoriasis. Other research has even found measurable ANS dysfunction in psoriasis patients, showing that this imbalance is physically detectable. And broader reviews, like one by Albeda, suggest that physical stimulation techniques can in fact modulate the autonomic nervous system. Now, this is a crucial point. While the foundational principles, like the nerve-skin connection, are definitely supported by a lot of research, the source material is very clear that large-scale clinical trials are still needed to validate this specific methodology. This quote really just brings it all together, doesn't it? It completely reframes how we look at this. A chronic skin disease isn't just an immune system problem, it's a neuroimmune system problem. It's an outward sign of an internal imbalance. And that leaves us with a final and pretty fascinating question to think about.